Well, thank you so much. This is Dr. Marc Darrow, and we're going to the second half of our show, Living Pain Free. And what we do, Dr. Grove and I, is what's called regenerative medicine. We use stem cells and PRP to regrow the tissue where there's arthritis or there's injury, orthopedic injuries, anywhere from the top of the head to the bottom of the feet and everything in between, all the joints, ligaments, tendons. And we've got several callers ready to go. So I'm going to give out the phone number to the office if anybody wants a free phone consult and a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. The foreword is by the lovely Suzanne Summers, rest in peace. And it's got a couple hundred pages and about 250 studies on how PRP and stem cells regrow the tissue and how surgery is not really working very well for most people. So we've got Dr. Buzz, who's been waiting the longest. We've got 3 callers here. So Dr. Buzz, what's going on? We got to move sort of quick here to make everybody else happy. How are you today?
I'm doing great. How are you this morning?
I'm living it up, but I always am.
Absolutely. The only way to go. I'm just calling to tell anybody out there listening that if you think that this is something that you want to do, sooner than later. Don't wait too long, because it'll work so much better if you get to it, because that's my experience. True. So that's all I wanted to say to you, and have a great 4th of July.
All right, Dr. Buzz, God bless you, and thanks for calling. And this is a quick issue I want to take before we get to Rogelio. I've had so many people have come in who don't want to get the treatment for one reason or another. And sometimes people come in on anti-inflammatory drugs like ibuprofen or things like that they've taken for years. And they say when they get off of it, their whole body hurts, so they can't. And then they finally get sick of the main injury and they come in and get that healed up. It's important to heal as quickly as you can, because the worse an injury is, the harder it is to heal. Let's be honest about that. So the question is, how soon do you come in? When you're sick of it. You know, we tweak ourselves as humans. We tweak ourselves all the time, doing sports or just falling over, bumping ourselves. And most of those go away by themselves. So you don't get a treatment of stem cells or PRP as soon as something happens, unless it's pretty severe. Sometimes, like we had a patient who had a car accident last week, and he came in for an immediate treatment. That, I think, is a good thing to do. But in most cases, you have to be conservative in medicine, and it's always good to come in for a consult. We can tell you if it's time for treatment or not. So, Rogelio, let's see what's happening with you. This is Dr. Marc Darrow with Living Pain Free. Yeah.
Good morning.
What can I do for you? You got a question for us? Yeah.
I think more of a comment. I was that patient who came in to see you last week. I had been sideswiped by a gentleman in an SUV who decided not to look over his shoulder, push on his gas pedal, and drive backwards from a parking spot and basically spear me in my truck. So, I want to go visit you, and I got a pretty thorough evaluation, which I was very happy with.
Okay, good.
But I've had extensive experience with prolotherapy, with stem cells, platelet-rich plasma, and some of the steroid injections in the past, which I found to be ineffective and very painful.
Okay. Well, there's 2 reasons for that. The painful is because most doctors use thick needles, and there's no need to. You can get that solution through a thin needle as well as you can get it through a thick needle. Okay? If you're injecting testosterone, as an example, that's viscous. It's oil-based. And you need... I actually have been using testosterone for hormone replacement therapy. I'm 78. I've been doing it since my 40s. And I was told to use I forget what it was, a 22-gauge needle, which is very thick. And that hurt like heck. So then after that, I tried a 25-gauge, which is smaller. And that hurt less, but not the way I wanted. Now I use a 27-gauge, and it works just as well. It's the same thing. You know, you mentioned a steroid injection that hurt. I don't like steroid shots. And the reason that doctors use a thick needle is they don't want to stress their hands. And many doctors who are surgeons are used to doing things on patients who are asleep, so they don't realize how painful it is. So thin needles are very important. And then steroid shots to me are horrific because they eat up the tissue. And they can often cause ligament and tendon tears. They can cause so many negative things. They can cause dimpling of the skin, discoloration. They can cause adrenal failure, believe it or not. Oral steroids are even worse. If you get a Medrol dose pack, that can actually kill the little vessel that goes to the hip, and then you end up with avascular necrosis of the hip. And by the way, we can often help avascular necrosis using stem cells and regrow the tissue around there. Even though most doctors say you have to get hip replacements, it's not necessarily true. So, well, thank you for your great experience in our office, and we're there to help the patients. We spend time, the way I pick my staff is based on their, in 1 second I can tell if a person has a good heart. And that's the people I pick to work with us. I don't really care if they're the hottest or the best in their field. It's more like I want the guy who's got the big heart who can love the patients to healing. I think loving is the best and most important healing that there is on the planet. So thank you very much, and we're going to go to Paul Matthews.
Okay, bye-bye.
Paul Matthews, are you with us?
My friend?
Hello, Paul Matthews. Hello, can you hear me? Dr. Marc Darrow.
Yes, sir. How are you?
I'm living it up, man. How about yourself?
I bet you are. I am doing really good. Very good. Ever since I saw you, my friend, I'm doing very good.
Wow, this is great. I'm having so many people that have had great experience. I was worried that maybe you had a bad experience. What's funny, no. Paul? Every once in a while, if you look at my Yelp reviews, there's, I don't know how many, 300 or more. They're mostly amazing, but every once in a while you get a curmudgeon. And I had a curmudgeon about 2 weeks ago who was complaining. And the complaint was that I told the person they didn't need surgery because they'd gone to an orthopedic surgeon who said they needed surgery. And that person did not need a surgery. And now they're mad at me and they gave me a bad review. So I'm glad that you have good things to say. Tell us what's going on.
Yeah, no, look, I would just say to your listeners, stem cells, obviously not my first rodeo. I've had a few rounds of stem cells. I've had 2 spine surgeries in my 20s. I'm 43 now. So I've been through a few challenging experiences with that and utilize stem cells as a recovery method. I wish I had known about it pre-surgery, but I didn't. And unfortunately... Well,
let me ask you the $10 million question. How did the surgeries come out?
Not great. I had complications post-surgically in both instances. I had an L4, L5 bilateral microdiscectomy in my early 20s when I was like 22, 23.
Yeah.
And then 4 or 5 years later, I had an L5S1 right side herniation removed. And in both instances, there were, the better part of year-long challenges. And, I think the bottom line is that a lot of what led to this was a lot of imbalances in my body and, things that I think with the help of stem cells, prior to the surgeries, I probably would have been able, hopefully, to have avoided them. But at minimum, it's been an incredibly useful tool on the post-surgical side to help rehabilitate the body and get back to a place of higher performance and no pain.
Well, I'm glad you've had good success with this, and I'm sorry we didn't get to you before your surgery. But, the thing about this is I have the same story with my right shoulder, which was operated on by my boss during medical school. And it's like I took the bullet for my patients because I knew after that I was not going to do any more surgery, that it was not a great thing for everybody. It is needed in certain periods, certain times. You have something ripped off the bone or a broken bone, you need it. But for all of these neck and back surgeries and, these labral tears in the hips and the shoulders, rotator cuff tears, meniscal tears, arthritis, it just is not needed in most cases. And I think it's horrible. I really think it's horrible. I'm not making a negative statement about the surgeons, because when I was in that culture wanting to be a surgeon, that's what I thought worked. That's all I knew about. That's all I was told about. And it wasn't until my shoulder surgery that made it much, much worse, and then healed myself by self-injecting myself, that I was better the next day. So, it's one of these things. Medicine is supposed to be done conservatively, and surgery is just not conservative. There's too many things. I've seen people die from it, which is, I'm not putting down the surgeons. I have to keep saying this.
For sure. You're speaking to sort of the difference, too, between some of these like acute traumas and something that's kind of chronic. And in my case,
you're right.
I had a couple of things that were very chronic. They weren't acute. They were chronic. They were repetitive motion patterns that were not good. And post-surgically, those things didn't necessarily change. So the surgery wasn't going to fix that side of it. And so, again, it is what it is. You can't go back. But
it is what it is, and you're doing better now.
I probably would have been in a different spot. So,
yeah, I hear you. But the good news is this: because of what you and I went through having surgeries, we know what to tell people about them. It's their choice if they want to. I'm not going to make anybody do anything. But doing things that are invasive are dangerous. It's that simple. We see infections after surgeries, even simple surgeries. Anyway, Paul, thank you so much. I appreciate your call, and I think that it's helped educate people quite a bit about the value of doing stem cells and PRP and, the potential side effects of having a surgery. It's just not that great a thing to jump into. And you were 22 at the time. You didn't know any better. But there's enough information. There's enough information there on the internet, ChatGPT, and all of these things that will show you the studies that are showing that surgery just is not the best way to go in most cases. And again, I'm going to say it over and over. I love you, surgeons. I love you guys. It's the hardest work in medicine. I did tons of it, and it's exhausting, and it's nerve-wracking because you can hurt people. So my hat comes off to the surgeons, but I don't like most of the surgeries they do.
Well, to that point, the last thing I would say would be most of this is just about getting to good outcomes. And I think the service that you provide, especially through an evaluation and just having a discussion, getting a deeper understanding of some of the things that might be driving this, people have nothing to lose. It has absolutely changed my life, and I would encourage anyone and everyone else to explore this because it can be an absolutely life-changing thing to explore. So I appreciate you.
It's very sweet of you to call in and let people know, And I think, there's one more thing that I think is important. Most of the people who come in with what we call failed surgeries, they had a surgery that made them worse, and we have a slew of those all the time. I ask this one question: did the surgeon ever touch your body? 99% of the time, people say no. Now, that makes no sense because the surgeon acted on an image. And from your point of view and your experience, Paul, because you treat tons of people too, what does the image tell you versus your hands?
Nothing.
Nothing.
Very little to nothing.
Yeah.
Hands tell a very different story. Movement tells a very different story. And you know as well as anybody. I mean, we could use the basic idea of saying if we went, I live in Chicago, if you took a MRI of 100 random people on Michigan Avenue, it becomes very difficult to understand the degree of a lack of correlation between the problems you'll see in people's spine and pain. You'll have people that have little to nothing going on, complaining about a lot of pain, and you'll have people with the most degenerative-looking spines on earth that aren't in any pain at all. So
I'm writing down your words right now. Lack of correlation. That's terrific.
Lack of correlation.
I'm going to use that.
Indeed.
Yeah, lack of correlation is the issue here because unless you're using your hands to find the pain generator on a patient, you don't know where that pain is coming from. You can't find it in an image. we don't
right.
work on the
nervous
image, and you don't
is the
work on the
critical
image.
piece of information, the link between the brain and the body, and beginning to understand where that communication breaks down, and whatever compensation is going on in the body, all these kind of things. This can make a huge window into understanding what's really driving pain and how one has to, create strategies to get out of this stuff. So.
Well, Paul Matthews, you can take over this show anytime you want, because you seem to know more than I do.
Oh,
You're amazing.
I'll
but
jump
you know
anytime.
it because
I will sing your praises. I really appreciate
so
you.
much.
I appreciate what you and Dr. Grove do over there. You guys run a world-class operation, and I'm just very grateful for the work you guys do.
Well, thank you. I appreciate that. God bless you, man.
Yes, sir. Yes, sir. Happy 4th.
Thank you so much. I'm going to give out the phone number so other people can call me. Live right now in the studio is 866-870-5752. 866-870-5752. Give me a call. You'll get a free copy of my book, which is Stem Cell and Platelet Therapy, Regenerate, Don't Operate. The foreword was written by Suzanne Summers. By the way, I worked on Suzanne many times, and her son Bruce, who was a bicyclist and was injured almost all the time back in the day. He was my neighbor, and after an injury, he would knock on my door, and I had my equipment at home, and I would inject him lying on the sofa on the floor. And I've treated his children, and I've treated Suzanne Summers' husband, Alan Hamill, and it's been a great joy to work with those people. So give a call to the office for a free phone consult with my staff. That's 800-300-9300. That's 800-300-9300. And we'll send out a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And what that means is you can often just regenerate the tissue that's been worn down with arthritis or torn, with an orthopedic injury of some sort. And you don't need to get surgery for most of these things. If you've got an emergency, get to the surgeon. If you've got a broken bone, get to the surgeon. Meniscal tears, rotator cuff tears, labral tears, arthritis, I don't think it's a great idea. Be conservative. Always be conservative. It's the first law of medicine. Don't jump to a surgery just because a surgeon says you need it. Go to a different type of doctor that likes to use his hands to find the pain generator. So it's very, very important. I'm going to go to the question that I was going to go to before the callers came in, if I can find it again. It was a great question. It says, I have scapular winging. The scapula is the wing bone on your back below your neck, and labrum issues. I'm assuming they're talking about their shoulder. It doesn't say. Looking for peptide or PRP help. So scapular winging, if it's true that's what this person have, that means that the scapula does not sit flat on the ribs, is typically a serratus anterior long thoracic scapular winging problem. The long thoracic nerve is the issue that goes to the serratus anterior muscle. And if that is damaged, the muscle cannot contract to hold the scapula down on the ribs. I rarely see it. I do see it once in a while, but I have a lot of people that come in thinking they have it when it's not the issue. And this is the whole thing with the type of medicine that Dr. Grove and I do, which is using our hands to find the problem. And this person says they have a labral issue. That probably means they had an MRI of their shoulder. The labrum is, in Latin, that means lip. It's a fibrocartilage that surrounds the ball of the humerus to help hold it in place. And labral tears don't usually cause pain. I know that's a brain twister for most of you that have these. But I have a labral tear in my right shoulder. I have no pain. By the way, I also have rotator cuff tears. I have a subscapularis tendon and a supraspinatus tendon tear in my shoulder. I have zero pain in my shoulder. I also am going to go play golf today, hopefully get time to do some weightlifting. And I like keeping my body young. At 78, most people think I'm in my 50s. I tell them that's too old. I'm only really 16 because I have that type of mentality. And I want to keep going as long as I can. So I have self-injected myself with stem cells and PRP in many areas. I've done both my knees, both my elbows, my right wrist, both my shoulders. I've had other doctors who are my friends end up doing my vertebrae in my neck, thoracic spine, and lumbar spine, and all of my ribs. Because of my gymnastics career as a youngster, I'm about as beat up as a guy can be, but I can do anything I want now. In my 40s, it was impossible for me to work out. I was in terrible pain, and after learning about regenerative medicine, I'm good to go. And I still injure myself, and I get right into my office. Thank God I do this work, because I can inject myself on most of these areas, and I get myself healed up pretty quick. So the last part of this is the person says they want to know if PRP can help. Hopefully, we need to do a hands-on examination before we can decide. A lot of people have what we call crepitus in their scapula. That means that there's a rubbing. It's not winging, like this person says, but it might just be that they're having crepitus or grinding, and we can help with that. We get those cells underneath that scapula to the area on the rib where it's catching. There may be some scar tissue or something like that. They also ask if peptides are the way, and in my humble opinion, they are not, but I have a lot of patients who sing their praises, and I have a lot of patients who've taken them who've had serious side effects. Super high blood pressure, which could lead to a stroke, rashes. They're coming up with a lot of things showing that peptides can be very dangerous. So far, they're unregulated. I'm hopeful that at some point the science will come in better. Some of them come out of China. People don't even know what's in them. So I'd be very careful if I were you on taking peptides, and a lot of people stack them to do several at a time. I know you, if you're watching Instagram and Twitter and things like that, TikTok, you may find that these peptide gurus who are making a fortune selling them are pushing them when they don't really know if they're doing much. And a lot of things like this can be what I call the halo effect, which is the placebo effect. When you do something like that, you can feel great and think that's it. Well, we're coming to the end of the show. God bless you all. I appreciate all of your callers and all your listeners. And if you want to get a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, call the office for a free phone consult. The office number is 800-300-9300. That's 800-300-9300. Or go to the website, stemcellinstitute.com. Send me an email through that website, stemcellinstitute.com. I love you all. God bless you all.
You've been listening to Living Pain Free with Dr. Marc Darrow and Dr. Thomas Grove. Now that you've heard Dr. Darrow and Dr. Grove, call their office at 800-300-9300 and speak to one of their staff absolutely free. And ask for a copy of Dr. Darrow's book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to stemcellinstitute.com. Again, the website is stemcellinstitute.com. Living Pain Free with Dr. Marc Darrow and Dr. Thomas Grove is heard Saturdays at 10 a.m., 1 p.m., and 5 p.m. here on AM 870, The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.